that okay? Do you need me to move the boxes?
Tell me a little bit about that. It's a pinch.
Yeah, it's like a pinch. Like when I turn like that,
Okay.
I can feel it.
If you twist all the way and kind of bend backwards from there, does that recreate it?
Not really.
Okay, and it doesn't shoot down the leg or anything like
No.
that? Okay.
It's literally like this. Like I can actually feel like tender right now, like kind of. And it's not like aggravated at the moment because I haven't been aggravating it. Wait.
Okay. Does it bother you with big breaths? So if you take a big breath in?
No, it's literally when I'm like bent over and I'm turning
Okay.
to
Cool.
face the camera.
So that's great that we have that kind of subjective measure because we'll do a few things in there. So it sounds like closing ankle pains whenever we go into that spot. It typically indicates that the joint is locked in on itself. So we can adjust that and then we'll retest it and then see if that opens up. And if it does, then we'll just kind of keep moving through that and that should stick with you.
Okay.
So cool. Hey, any neck stuff, mid-back stuff?
Sometimes, yeah, like when I'm sitting down, I get pretty bad like back pains. Like I don't really have any other like issues in my like legs or stuff like that, but it's mainly like back pain.
Cool.
I would say.
So we'll kind of do a full body adjustment. Okay. So we'll start with the neck and then we'll kind of dial in on that lower back and then we'll keep rechecking that stuff. Have you seen a chiropractor before?
No.
No? Okay.
I should.
Perfect.
I should be like every week. I think.
Yeah, you've just seen the videos.
Yeah. So I'm nervous. Like.
Well, let's go ahead and take a seat right here. I'm gonna have you facing that direction. Perfect. And then go ahead and look all the way over the right shoulder. Any pain, pinching, or tightness with that?
Maybe a little bit of tightness.
Kind of pulling over there, and then over to the left, same thing. That feels pretty good.
Yeah.
Looks like you have a lot more motion. So.
Okay.
When I push in right there, is that a little bit more tender than on this side?
Yeah.
Okay. And then as we kind of come up through there, do you get headaches at all?
Not too bad.
Okay.
Oh god.
I'm gonna close this window real quick.
Go for it. I feel like we should close that door actually, just for like better.
There
if you're panning around.
Oh god, now we got the ASMR. Okay, cool. So I'm gonna have you scoot forward all the way. I'm gonna jump up here with you. Look at this hand right here. Yeah, perfect.
Oh gosh.
So all you have to do is nothing. So just kind of let the head fall.
Oh god.
There. Cool.
Oh god.
So we'll find that tension spot.
Oh my god.
Can I do a little pull right there?
Oh god.
All right, not too bad.
That was the first time I've ever had my neck cracked.
Perfect. Let's go into your back. These are gonna be a little bit easier. That was like the super epic looking one. So it's kind of the lower part of the neck. So you can scoot down actually all the way. Keep going. I'm gonna take this guy.
All the way. Whew.
All right, you're still alive.
Okay. Just. Oh my god.
So before we get into the next adjustment, I want to do a little bit of soft tissue. So you can just relax the head completely here.
Oh, okay.
Yeah, good.
Oh my gosh.
And I'm just gonna hang here for a minute. I'll let you know before we adjust. So. All right.
I feel like you're gonna snap my neck off.
I'm not gonna surprise you though. Do you get like massage work or soft tissue work at all?
Sometimes I try to go get like Thai massages, but I really just don't have time to do anything else apart from work and sleep.
Really hard to set time aside for yourself. I feel like if it were me, I would not. Like, I work in a chiropractic office, so I get adjusted like once a week, but whenever I have patients that come in consistently, I'm always like, wow, good for you. Yeah. Because whenever I do get adjusted or if I do get massage work done, like, I always feel better afterwards.
Yeah.
Like, I do need
I
that.
think like getting Thai massage isn't enough. Like, I think I do need to be, I was thinking about it in the last few weeks. Like, I need to be seeing a chiropractor every week.
Well, we'll see how you feel after this. And if it is, I can find somebody good for you. I've worked with a lot of the guys out here. Get you set up.
Great. Something not too far from me.
Yeah.
So I'm like motivated to go, you know.
Yeah, that's a huge portion of it. It's accessibility.
Yeah.
Cool.
Yeah.
So we're gonna do a little push. You're really locked up on this left side.
Okay.
So I'm gonna do a little push right here.
Oh my god.
How was that? Not too bad?
That was wild.
It's just kind of scary, right?
Yeah.
The first ones are always the craziest because you don't
Oh
really
God.
know what's going to happen.
Are we going again? Oh my God. Oh God.
Drop this right shoulder down. You got
Oh God.
this.
Oh God. Oh God. Oh God.
So our lockout spot is right here. I'm going to do a little push past that.
Oh God. Oh my God. Okay.
You did it. That was like the hardest part. So we got the hardest part over with.
That's crazy. Okay.
So I'm going to take both hands here. It's all easy from here now.
Really? Okay.
So we're going to get into the mid-back and then...
It doesn't actually hurt. It's just like, whoa.
Yeah, exactly. Yeah, it's just surprising. So go ahead and tuck your chin down towards your chest. Let all the air out.
Oh. I love it. Crunchy.
Actually, come on up
Crunchy
this
nut
way.
cereal.
Yeah.
Do
Captain
you guys
Crunch.
get crunchy nut cereal here? No.
We have
You get
Captain Crunch.
It's like when you're chewing it. It's my body right now.
Scoot back just a little bit. It's called Crunchy Nut.
Yeah, crunchy nut clusters and that's the bougie one, the crunchy nut clusters.
That is
it's like me right
hilarious.
now.
So I'm gonna come through at this angle if you want to kind of come down. So I'm gonna have you take your hands like that, and then we're gonna come low onto the neck. So a little bit lower. Yep, perfect. We're gonna bring the elbows in, and then I've got you here. We're just gonna be really relaxed. Perfect.
Oh God.
There we go.
Oh my God, Mom.
So scoot down just a little bit. I know you're falling off the head.
That was great.
Yeah, that
I
was
liked that
closer to the area that you're talking about.
Yeah.
I promise we'll get there. We're going to get this one in, and then we're going to get into the lower back. So go ahead and lift the head up real quick. Did you see this one online?
No.
Go ahead and relax your head back. So I'm going to do a little test pull.
Okay.
Just to make sure everything feels good there. You're like, what is happening?
What is going on? You're gonna pull my head off.
So when I kind of pull
Oh,
that
God.
in range, does that feel okay?
My head's gonna come off. Okay.
Yeah, it might come off.
Oh God.
I'm just
Okay.
kidding. We're gonna do a little pull
Oh,
in.
Wow, that was crazy.
A little spicy here. Yeah, take some big breaths through here.
Yeah.
So I just had this done like 2 days ago.
Spicier than anything I've.
They don't do this with the massage?
No.
No.
No. I've been like paying these like Thai ladies that just like I don't know. I don't actually think half of them really know what they're doing. Half the time I'm sore for like a week afterwards.
I do Thai massage like every few weeks as well, and I mean I always walk out feeling pretty good, but I know everybody's a little bit different with the style. I know this isn't the most comfortable thing in the world. Are you doing okay with the pressure?
Mm-hmm.
Okay, just keep taking some big
You just
belly
gotta
breaths.
think of the outcome, right? I'm gonna feel
Aggressive
so good
treatments.
after this. Yeah.
Aggressive results. Yeah. Is that tissue starting to calm down a little bit?
Mm-hmm.
Okay.
Yeah.
Yeah, so you might be a little bit sore after this for like the next
Oh
day or two.
God. Oh God. That means the next like week or two. You guys always like downplay it, and then I'll literally be like walking around like can't bend over, can't eat my crunchy nut cereal, nothing.
Oh my gosh, I need the crunchy nut. I don't think you'll need to eat the crunchy nut cereal after this.
I know.
So where are you from originally?
Originally New Zealand, but
New Zealand.
I was living in Australia.
Okay.
Everyone calls me Australian because they just don't know where New Zealand is.
I have a friend, his mom's from Australia, his dad's from New Zealand, and I can't figure out the difference between the two accents. I'm
Yeah,
sorry.
the accents.
I'm one of those two.
It's kind of like for us, like Canadian versus American.
Right.
It's very similar. But if you're from America, you obviously, you know. So it's like,
right.
but-
like a country accent. I grew up in
Yeah.
Nashville, so I hear that. But
so for us, we can tell the difference. But for you guys, no. Because they're so similar.
how we doing?
Great.
Feel good? Okay.
Anything
So
up?
you're good
No.
right there. We're just gonna run through all the joints, and then we'll finally get into the lower back, which is kind
this
of what
is
we're talking
great.
about.
Oh gosh. Oh my God.
These aren't always the most comfortable.
Oh gosh. Yeah, hand stuff is like really.
Yeah, it's very
Not
sensitive.
it.
There's a lot of nerves in there.
Oh my God. Oh, he's destroying me.
Oh, man. Cool. So come on into the ankle here. We're gonna do a little pull.
Oof, yeah. No, it's good.
Okay.
It's great.
This is definitely not going to be an ASMR video. We're just going to do...
I love ASMR.
Yeah, people
God,
definitely aren't going to
toes.
fall asleep. So
The foot guys are going to love this. Yeah.
That's why we do it. She goes, yeah, get it.
Yeah, on that. Oh, yeah. Oh.
That's
You're
hilarious.
making me jealous right now.
Right?
You get to touch every single one of them? Oh my gosh.
Perfect. We're gonna get that ankle. This one's not the bad ankle.
Yeah, this is the good one. This is the good one. It wasn't too bad.
Our cameraman's crushing it.
Oh my god. This is great.
Good. I know, you're gonna be ready to go.
So what can I do? Like run a marathon after this?
I usually recommend to do activity after getting adjusted, so you kind of lock in that new mobility that we gain. So let's go into your side facing me over here. So you can put your head right here. Did I catch you? Yeah. Sorry. So your head can go right there.
Yeah.
Yep, that's perfect. And then we're gonna bend this leg. I'm gonna pull this shoulder, and you can hold on to the elbow. So we were having the twist in the opposite direction. So it's going to be the next side where you kind of really feel that relief. But this will be kind of our warm up. So look over the shoulder right here. And that motion feels okay?
Yep.
Okay. That was great.
I was not expecting that.
Not too bad, yeah. Let's go ahead and flip on over to this side. All right. Yeah, I'm definitely going to have to make the screams a little bit less for people wearing headphones.
Sorry, guys.
Oh
gosh.
So that motion right there, is that kind of where you're feeling that pinch?
Yeah.
Okay. So when I take you into that spot, so that's how it's going to feel, just a little bit more. That feels okay?
Okay.
Okay, so a little push.
Wow, that was crunchy, really. Wow.
Yeah, that was the spot.
Yeah. Yeah.
Awesome. Let's go ahead and come on up this way. I want you just to recheck it with the adjustment. I'm just hooking you up this way.
Sitting up?
Yeah, so go ahead and stand on up and find that spot again. Let's see how that feels. We're going to do a few more things, but I'm just curious if just the adjustment kind of cleared that out. Still there?
It's actually, it is on both sides. Sometimes it's more on the side. Yeah.
Okay.
It's like really in here.
Are you cool if we do some dry needling in there?
Yeah, it doesn't leave them the cup. It's not cupping, right?
It's
It's
cupping.
different. Yeah, that's fine. Oh gosh.
Have you had acupuncture before?
No.
Okay, so it's little tiny needles, and then I'm gonna hook it up to a circuit. So I have similar issues with my rotation.
Yeah.
The adjustments don't help me as much. This shouldn't be painful though.
Okay.
It'll feel good. It's kind of like a deep muscle massage. So,
Okay.
and all you have to do is nothing. You can just lay there.
Oh my
It'll be
God.
easier than everything else we've done so far. So if you want, you can lay onto your stomach and then just have your head facing that way. All the makeup and from everybody. So you can look one way or the other. Yeah, and then if you want to come in from that side.
I like your Crocs.
Thank you. Thank you.
Yeah, great view down here.
Yeah.
Oh, you got cool shoes as well. Holy shit.
We're all crushing it.
Styly.
The styling department. All right. So, so no acupuncture you said before.
No, never.
Okay. Cool. This is my favorite thing for treatment. So when I have like flare-ups, this is like my first go-to.
Oh my God.
I feel like it really takes me out of that pain state. So.
Yeah, it's constantly in the way, like every single day, like when I'm trying to twist and I'm just like it's so painful. So.
Sorry, I packed everything up in my car and it's in a
No, that's okay. Where did you come from? Vegas?
My main office is in Denver.
How far is that?
It's a flight away.
Oh, wait, so you're hiring a car?
So what?
You're hiring a car?
Yeah, I like rented a car. Oh my gosh.
Where did you
have
drive
to, like,
from?
off video then. We'll just figure it out as we go. I don't know how those tangles happen in like 2 seconds, but they do. All right. Now I need the actual needles.
Oh my
Oh,
gosh. Wait, you don't have them?
I thought I did for a second. Okay, so I'm gonna pinpoint the spot. I'm gonna tuck this in right here. Is it okay if I slide this down just a little bit? Okay.
Yeah.
Okay, so you were kind of pressing or talking about this.
Yeah, I think that on the left you've got it,
Yeah.
but maybe
It's not as bad on the right.
On the right?
So that's the spot right there.
I think it is both sides, but I think the problem is that I'm always turning to the left, and that's why
Okay.
I'm feeling it. But when I just turn to the right before, I'm like, yeah, it's definitely both sides.
Okay.
But I think I aggravate it because I twist to the left.
Cool. So I'm gonna go into kind of our spinal musculature right here, and then we're gonna go into our erector muscles right here, and we'll create a little circuit. I'm gonna just do a little alcohol prep pad real quick.
Oh my god, how painful is this?
It shouldn't hurt at all. It should actually feel pretty
Really?
good. Yeah, I think of it as like a massage on steroids.
What?
So it's not like a medical needle, so...
It's not like thick like when you're getting a vaccine.
Yeah, exactly. So we're not injecting anything, so you might not even feel anything from that.
The thought of it is like...
Yes,
makes
it's mainly
me
just a mental thing. So the thought of that is kind of what gets me. So I hate needles. I feel like I used to like pass out until I started to associate it with like my health and feeling good. So ASMR noises.
Oh yeah, that's so nice.
All right, cool. So our first one, we're gonna go on the opposing side. Cool. So this is just the casing of it, and that is the needle, and that is it. Not too bad, right?
Yeah.
Perfect. So it's a little tiny muscle that sits right on the back of the spine. So all right.
Oh god.
Good.
This is so...
Perfect.
That's another one in?
Mm-hmm.
Okay.
Yeah, I'm gonna see if we can get into the erector tissue one more time on this side. So poke. There we go. Good.
Ooh.
Yeah. Perfect. You did it.
Yeah, that one hurts. Is it meant to?
Is it still hurting right now?
Like a little bit, like uncomfortable, but like it's not like I can.
Is it
deal
stingy
with
or is it dull and achy?
No more achy.
Perfect. So achy's good. I mean, think about the pain that has been there for a while, right?
Yeah.
Sometimes it takes a little bit. You know, we're working in areas that are already painful.
Okay.
So we might have a little bit of discomfort, but it's not designed to be like painful. That's all I'm gonna do with the needles right now. So you're good. I'm just hooking up this little stem unit right here.
Mm.
So I'm gonna slowly start turning up the intensity.
Oh my god.
I want you to just let me know when you start to feel anything. You'll feel kind of like a little thump, and it should feel good.
Oh my god.
Yep.
Is it gonna be like crazy?
It can be if you want it to,
Oh
but
my god, no.
it doesn't need to. How
Like,
we
is it
doing?
gonna be painful?
It shouldn't. This is like the feel good part.
Oh my.
I'm just going up really slow. You're not feeling anything yet?
I don't think so. Oh, I felt something kind of down my bum.
Okay.
On the left.
Yep.
Just a little bit though.
Okay. Do you want more or less?
You can do a bit more.
Okay. You tell me when.
Oh. Okay, yeah, you can keep going though.
Okay.
Oh, a little bit twitchy. Oh, yeah.
Got a good spot right there.
In that left side of my back, I
And
can
that's
feel
all I
it.
have circuited. We actually can't see it, which I'm surprised because I've got you like all the way turned up to 10. Most people kind of lock out at 4. So.
Oh
good job.
gosh. Is that good or is that like concerning?
No, everybody's
Does it
just.
mean my body's broken?
Everybody's on
Like
just
it just
different
doesn't
levels.
function anymore.
Different muscles. This one's too tangled up and I didn't want to get another one in there. So I'm going to get this left side going. I want you to just let me... This looks like a tangled mess. We'll see. I'm going to get crap on this for YouTube. So on this right side, let me know when you start to feel anything.
Yep.
You feel it?
Yeah.
Is that a good spot?
Twitching. It's like...
Yeah. Do you want more or less?
Yeah.
It doesn't need to be crazy.
Yeah, you could go a little more maybe. Whoa. That's wild.
Yeah, I'm excited to see how you
It feels like a tattoo gun going.
Yeah. I don't necessarily need it to be crazy.
Cause. Yeah. Wow. I don't know.
Let's see. So we can individually. So I had a circuit going through here. We can individually go to each one. So this is our spinal one. It's our multifidus muscle.
Uh-huh.
So let me know when you start to feel that. Does that feel a little bit different?
A little bit, yeah. Oh, yeah. Now it's like hammering on there.
I'm gonna hang here for about 30 seconds. Is that manageable?
Okay, yep.
Okay.
Easy peasy. Lemon squeezy.
So when did you move out here?
Like to LA. I spent like just a month here.
Okay.
I just moved to this place like 2 weeks ago.
Nice. So all new things.
But I've been in America for 3.5 months.
Are you missing your crunchy pops?
Crunchy nut clusters. Yeah, I miss them. Nah, I don't actually eat those a lot, to be completely honest. But
Gotta have them shipped over here. Okay, and then I'm gonna hit both of these, so we might feel that circuit running through both of them.
oh yeah. Oh my god. Okay.
Is that a little bit better?
Yeah, that's cool.
Okay. I'm wondering if I just twisted one of my wires on this side. That's why you weren't feeling
You were like, this
much.
girl's crazy. She can take level 10.
Yeah, meanwhile, there's like no battery in there. It's a lot more comfortable when I'm at my office. I have like everything where it is, and the
Yeah.
environment's the same. My table's a little nicer.
what level is this now?
This is a different unit, but
Oh,
you're
is
at
it
like a
different
2 out of 10.
Oh, okay.
Is that way more intense?
Yeah.
And it just depends
Ooh.
on like what part of the muscle belly.
Oh,
and
it stopped
everything.
twitching.
Yeah, let's call it that done.
Okay.
I'm gonna do a little bit of soft tissue, so I'm gonna pull these guys
Oh
out.
god. Ah!
All right, and then we just have one more.
Oh my god.
Needle free.
Okay. Is it bleeding?
No, you're not bleeding.
Because that's so fine, right? Like pieces of hair, like.
Actually, I lied to you. So this one probably felt a little spicier because we hit a vein.
Okay.
It's not really even gonna leave a bruise. It's so small. Did that one feel a little spicier on the right side?
That was the first one that I felt something on, you know.
Yeah.
But it wasn't like crazy painful.
Well, you did it.
Yes.
Let me. I'm gonna do a little bit of a CBD scrape. I'm gonna do a little bit of soft tissue, and then we'll call it. Thank you, promo. Nice shot. All right, cool. So, have you had scraping before?
No.
Okay, this is all it is. Is that okay?
Yeah.
Cool. So this is just a little bit of CBD, mainly using it just as an emollient, but we get a little bonus anti-inflammatory effect.
Okay.
Have you ever used CBD products?
Yeah, I've used it like orally for like drops for anxiety.
How's that work for you?
It worked, but I don't know if it's just placebo, you know what I mean?
I know it's hard to tell sometimes. I feel like animals are a good effect of like the placebo,
Yeah.
like with CBD.
Yeah.
I've heard like pretty cool things with like watching their gait and walking, and you know, they obviously don't know what they're ingesting.
Yeah.
So I feel like that's always like kind of a good indicator. I feel like too, it passed the test of like the fad where it was like 5 years ago.
Yeah.
I feel like it was kind of a fad thing, and it's continuing to be alive, but it was also still a thing 13 years prior to that. So
Yeah.
I think there has to be you know, some type of
That feels nice.
efficacy to it.
Yeah, I believe so.
Pain literature is just really hard to get. Are you doing okay with that pressure?
Yeah.
Okay, I'm gonna just hang here for a little bit. Keep breathing.
Oh my gosh.
Yeah, so we can definitely tell
Yeah.
this side is like compensating and working a lot harder than the right. Because when I press in right here, see how that's not as
Yeah,
bad?
like that side is so much more tender. Like when
Um,
you're doing it. Oh my god.
and I'm like barely pressing.
Really? It feels like you're like weighing your whole body on there. Oh
Yeah.
my god.
Yeah, we're like a 2 out of 10. You doing okay on pressure?
Yeah.
Okay.
It's good. It's good. Okay.
You said you're working out today?
Yeah, well, I was planning to. Should I?
Definitely.
Best to? Yeah, I will then.
Yeah. And I'm definitely going to have you kind of work and move and twist into those places that we've opened up.
Okay.
So, just for the camera, let's say you came in today, you can only turn your head like a quarter to the left. And then we adjust you, and now you can look all the way over your shoulder.
Okay.
If you did nothing for like a week, you'd slowly come back to that start point.
Yeah.
But if we start moving and using that range of motion, we create that brain muscle connection. So I don't think that somebody necessarily needs to see a chiropractor every single week for the rest of their life.
That feels so good,
if
that what
they're
you just
active.
did.
Yeah.
I
Do you mind if I
need
press
to
into
see.
the side of the hip here?
Yeah, go for it.
Bring it one last muscle. So coming in here. But yeah, I kind of think of chiropractic as just a tool to kind of jumpstart the system, where it gives you temporary increased range of motion, decreased pain, and then it's your job to kind of utilize that window and work and move into that, so it becomes more of a normalized thing for you versus my patients who are less active. They might need to feel like they have to keep seeing me once, twice a week.
Yeah.
You might just need it as needed. So,
Okay.
but you obviously have active job.
Yeah.
So I don't think it's necessarily a horrible thing to get body work done.
No, it would be wise.
Let's go ahead and come on up. We can face this way. You can bring the feet that way. I'm gonna do a quick shoulder adjustment just to finish off with the adjustments, and then we'll kind of recheck that spot. So I'll do a pull. And one more pull up this way.
Oh,
That was my elbow.
you need some adjusting.
Magic tricks. Go ahead and stand on up. Let's kind of rotate into that spot, see how that feels.
Okay.
Any different?
I feel like this side feels better.
No, the right
This
side's
side is
jealous.
still sore. Yeah.
I can go back into that spot. We can.
On the right?
Yeah. I can do the same stuff that I did on the left.
Okay.
That's probably what it is. We'll just off camera that though, because it's already a really long video. Do you want a high five?